So, common fears amongst particularly patients and even amongst physicians are that hormones cause breast cancer. And frankly, this is even often expanded to all cancers. Patients will come in thinking that hormones cause cancer. And we often need to spend a lot of time discussing kind of what we know and what we still don't know about the relationship between hormones and cancer. However, there's a big distinction between local vaginal estrogen and systemic hormone therapy. And I think there's a lot of confusion out there. And really, as OBGYNs, we have a responsibility to speak to these issues and debunk a lot of the myths and explain that what's commonly understood about local vaginal estrogen is really uniformly believed amongst menopause experts that it's very, very safe to use in the population, no matter what the age of menopause, the onset, the time since the menopausal transition, and even survivors of breast cancer can safely use local vaginal estrogens. Yeah, and a lot of the, things that compound this misunderstanding are the continued FDA box warning on local vaginal products, because despite speaking to these issues and reassuring patients that local vaginal estrogen is safe to use, even in these various circumstances where there's been a long time since menopause or someone's a survivor of breast cancer, the patients get home and they open the medication, they see this box labeling, and if the fear of breast cancer isn't enough to prevent them from using this therapy, it even lists probable dementia. So that's certainly enough to scare somebody off. And sadly, the consequences of not using some of these options are not only continued vaginal dryness, discomfort, pain with intercourse, urinary frequency and urgency, an increased risk of urinary tract infections. And this really contributes to not only continued suffering, but increased healthcare costs. So we really have a responsibility to speak to these issues, speak to the nuances and the differences between a local vaginal preparation designed to treat the symptoms of genitourinary syndrome of menopause and systemic hormone therapy. And we need to continue to debunk the conflation of these issues and what's talked about on social media. And I understand sitting in your shoes, being a practicing clinician and having patients in the room, but we need to have these conversations, and you will only improve your credibility by speaking to some of these issues. Not only do we have a responsibility to our patients, but as leaders in the delivery of care for midlife women, as OBGYNs, we need to continue to educate our colleagues in other specialties. Now, the American Urologic Association has just come out with guidance actually encouraging the examination of symptoms of genitourinary syndrome of menopause, the treatment with vaginal estrogen, and multiple societies, including the Menopause Society, and even ACOG has statements regarding the safety of local vaginal estrogen. But we need to be at the forefront and we need to have these conversations and we need to open the doors to these discussions because, as we know, it's difficult for many people to talk about sexual function, to talk about their symptoms. There can be a lot of shame. There's a lot of stigma with aging. And we even see this in breast cancer survivors at very young ages. So we need to be at the forefront of these discussions. We need to ask these questions. We need to reassure people. We need to understand the distinctions and speak to that FDA box warning. And we're really advocating removing this box label. But in the meantime, you're the one that can make the difference between somebody not only filling the prescription, but actually using the prescription as directed to improve some of these symptoms. So I find a really helpful approach is to not only have these conversations in the office, which often we understand are limited due to time constraints and access, but to even provide trustworthy evidence-based resources to patients so they can do some of this research on their own time. The Menopause Society has great resources. I lead people to also sites like the Mayo Clinic. Let's Talk Menopause has a robust online library with a bunch of educational resources, talks, and webinars. So I find the best approach is to have these conversations in the office and follow up with, the most recent evidence-based handouts, resources so that you can partner with your patient and really open that door for longer discussions if they have follow-up questions. And I find being proactive and telling them when you go to the pharmacy, not only might this cost more money than you're expecting. There are often coupon cards. We're also mandating for better coverage for menopausal care and hormone therapy, even local vaginal estrogen. But I speak to the costs. I speak to the black box label. I speak to the expectations and the importance and the benefits of treating these symptoms, which are progressive and long term. And as OBGYNs, we know that 50 to 90% of postmenopausal women suffer from these symptoms, and they're largely untreated. And we need to be part of that solution, and we need to have the hard conversations. We need to bring up sexual function. We need to talk about fears, costs, access to healthcare, and really be a part of this solution. Another common fear about estrogen use is actually the risk of clot and stroke. And again, local vaginal estrogen has never been shown to increase the risk of clot or stroke or adverse cardiovascular events. So we can all be very comfortable not only telling our patients, but telling our colleagues and reinforcing the importance of use of local vaginal estrogen because there is not an increased risk of clot or stroke, adverse cardiac outcome, breast cancer risk, and there is certainly no evidence to suggest that probable dementia would result from the use of local vaginal estrogen. So please be part of the solution. Your patients deserve this care.